our practice had to change a lot during the pandemic, and we were allowed very early access to drugs that we would normally have to wait before we use, because the TPO receptor agonists, for example, are licensed mostly they're licensed for slightly later ITP than newly diagnosed. But we've been using TPOs really from the very beginning of the patient's journey. And that's because the governments in many countries recognize that immune suppression during the time of a pandemic is not good therapy, because it puts patients at risk of COVID infection. It may make them more ill, or sadly some may die, and also it affects vaccination with some of the drugs like rituximab. So we've relied very heavily on the use of romiplostim, eltrombopag, avatrombopag. Now, as we come out of the pandemic, we've been thinking, do we want to go back to the old model of therapy where we use immune suppression for a while and rituximab and then later use a TPO? And we don't really want to do that, but we are constrained by our countries and the rules and regulations and access to drugs. So I think what we're going to be doing is we will be using TPOs more than before the pandemic, but we will not be using them to quite the same extent as during the pandemic. I think we will start to use some immune suppression for some patients who will be able to tolerate immune suppression. So this is still being debated now as to what we do in terms of treatment pathways. It's not fully decided, and over the next several months, I think it will become clearer. That's about as much as I can say right now. And much of the prescribing is very dependent upon finance and the way that healthcare is provided. For example, Europe, United Kingdom, is a public health system largely, and these drugs are strictly regulated. America, for example, is a private healthcare system, and patients get access to drugs much more easily through their insurance companies. We don't have that luxury. Most of Europe doesn't have that luxury. The Middle East, I suspect, is a mixture of private and state also. So it depends where you are, really.